Hey friends, happy Monday. Sorry for the late rant today, but we're going to continue on with our eye impact and population health topics for today. And now, a few weeks, or maybe even a couple months ago now, I talked about social determinants of health. And I want to go into that a little bit deeper today. Now, social determinants of health are the factors outside of healthcare that actually impact our patient's ability to follow our treatment plans, impact our patient's ability to actually be healthy. For example, do you know where your patients live? Do your patients live in areas that have access to fresh fruits and vegetables? Do they have easy access to just a quality grocery store? Your diabetic patients, are they in an area where they can get easily and actually physically access the foods that will keep their blood sugar stable and at a low level? Do your patients live in areas where they can physically get out and walk and exercise? And is it a safe environment in which they can get the exercise they need to be healthy? Those are things that are really challenging. Now, there's a lot of research out there that shows that social determinants of health, when doctors and health systems actually take social determinants of health into consideration, it actually significantly helps our patients to improve their overall health and their ability to follow our treatment plan. So things like race, things like sexual orientation, things like just demographic information really impacts reliable transportation. How far is it from first of all, do our patients have reliable cars to get to their doctor's appointments? How far away are their doctor's appointments? How far are they? Do they live in a rural area where the nearest primary care provider is a half an hour away? The nearest optometrist is a half an hour to an hour away. A nearest specialist is 2 to 3 hours away. How does that impact our patients' ability to access healthcare when it's necessary to prevent and to treat and move beyond the morbidity of disease? Yeah, how long does it take? How far is the nearest bus station from a patient's house or apartment, so from they can physically get from their locate where they live to just get to transportation? And then how long does it take on a bus ride to or a train or any mode of public transportation to then get to their doctor's office? These are things that if we work to break down these barriers to accessing, utilizing healthcare, but also being healthy, we'll actually start to see our patients get healthier. So a lot of work going on, a lot of research showing that when we address these factors, patients get healthier. We can use a lot of technology to help implement or help identify these social determinants of health. Another research article recently published, what's going on in the EHR space? How can we leverage technology? And a lot of that's demanded by the actual users. So my challenge this week is demand of your EHR company that we start putting things in to help us identify, track, and work towards improving our patients, or addressing and decreasing barriers for those social determinants of health. Have a great week.